Hello everyone. Welcome to session on communication skill for healthcare professionals. Our focus is on mastering the skill of taking consent before any medical procedure or surgery. This is not just a legal formality, it is an ethical responsibility and a cornerstone of building trust with patients and their families. Let us break it down step by step. First, why consent matters. Consent matters for many reasons. First of all, for legal protection. Yes, it safeguards the doctor-patient relationship and protects you from medical legal issues. Second, it is our ethical duty. It respects patient autonomy, their right to make informed decisions about their body. Third, it helps in building trust. Yes, proper consent ensures transparency, which is essential for trust and long-term relationships with patients. Let us see do's and don'ts about the consent. What we need to do. Let us discuss about the do's. First, be clear and simple. We must use layman's term instead of medical jargons. Let's say example. Instead of saying we will perform a laparoscopic cholecystectomy, we can say that we will remove your gallbladder using a minimal invasive method with small cuts. We must provide complete information. We must explain the procedure, its purpose, potential risk, benefit, alternatives, and consequences of not proceeding. Communication should be tailor-made to the patient needs, education, cultural background, and emotional state. And fourth and most important, documentation. Documentation is everything. Ensure written consent is properly signed and dated. Fifth is encourage questions. Yes, ask. Do you have any concern or questions? And sixth is a visual aids if required. When we are explaining, we must draw the diagrams or model which can help patient understand the complex procedures. Now let us discuss about some don'ts. We must avoid rushing. Consent is not a checkbox. Take your time. Do not pressurize. Patient must feel their decision is voluntary. It respects the autonomy. We must avoid assumptions. Never assume that the patient or family already knows and understands everything. Should not neglect body language. A calm tone and open posture can make the conversation more reassuring. We must have a positive body language. And avoid delegating to non-medical staff. Consent should ideally come from the treating doctor only. We should not expect the other person to take consent. Now, let us see what are the different steps of communications while taking consent. First comes the introduction. We must start by introducing ourselves and establishing rapport. Like, hi, I am Dr. Vishal. I am your child's pediatrician. I will explain the upcoming procedure and address your concern. We must explain the procedure. We must describe what will be done, why it is necessary, and how it will help. Your child has a condition that requires a minor surgery to correct blocked tear duct. This will improve the ability to drain tears properly. Just smile. We must discuss risk and benefit. Be honest about the risk without overwhelming the patient. Like example, this is a safe procedure, but there is a small chance of infection or bleeding. We will take every precaution to minimize the risk. That's how we can say it. Fourth and most important is offer alternatives. We must explore and offer another alternatives. Like another option is waiting to see if something resolves naturally. But this may take time and could cause discomfort to patient. We can say that. 5 most important is address questions. Give patient time to act, react and proceed and ask questions. You can say that. Would you like me to clarify anything? Should I repeat anything? You can take your time to decide. If you have any concern, any question, please say that. Give time to hear. And most important thing, confirm understanding. At the end of our conversation, we must summarize the key points and ask patient to explain back. Like we can say that, can you tell me what you understand about the procedure, or we can summarize and let it confirm by the patient or parents, whatever. And most important thing is a document consent. We must ensure the patient or legal guardian signs the consent form and returns it a copy. That is most important, because documentation is necessary. Without documentation, consent is not done. So let us see some useful tips for the effective consent communication. We must use a calm, empathetic tone. Patients are often anxious. We need to reassure them by showing confidence and care. We must involve family members. See, in India, family, culture and community can impact a big on a person. So, families or any respectable member from society are necessary to include during conversation. Like, you like me to explain this to your spouse, your parents or your friends, whatever. We must be mindful of our cultural sensitivities. Like some patient may hesitate to ask questions due to respect or fear. We must encourage the openness. You can say that it is okay to ask me anything, no matter how small or big. And India, the financial sensitive market, we must explain the financial implications. The transparency about the cost is important to avoid misunderstanding. And what? Ensure privacy. Have the consent discussion in a private and quiet place. So, taking consent is not just a procedural requirement, it is a skill that requires practice, patience, and empathy. Mastering this skill will not only make you a better doctor but also strengthen the trust between you and your patient. Remember, best outcome come from informed decision made collaboratively between doctor and the patient. Thank you for watching. I encourage you to practice those steps during your clinical posting. Thank you.